Tuberculosis is a chronic granulomatous disease and a major health problem in developing country. It is a chronic disease, tuberculosis. Okay, TB. The long-term treatment is there. According to clinical utility, the anti-TB drugs can be divided into first-line and second-line drugs. First-line anti-tubercular drug and second-line anti-tubercular drugs. What is first-line? These drugs have high anti-tubercular efficacy as well as low toxicity. Okay, and they are used routinely. And what is second-line? These drugs have either low anti-tubercular efficiency or higher toxicity or both. Okay, the second-line drugs, always first-line drugs are administered by physician. Okay, if there is any problem with first-line drug, then the second-line drugs are selected. What is the meaning of first-line? These drugs have high anti-tubercular efficacy as well as low toxicity. That means it is more beneficial. Okay. Then second line, these drugs have either low tubercular efficacy or high toxicity or both. Okay. What happens? Listen carefully. First line and second line drugs. And what are the don't laugh. What are the examples of first line anti-tubercular drugs? The example of, you have to all remember. Okay. If you are not remember properly, then you cannot write. If there is any wrong example, mark will be reduced. First line drug, anti-tubercular drug example. Number one is isoniazid. Isoniazid in short form it will be represented as capital H. Then number two, rifampin, that is capital R. Number three, pyrazinamide, capital Z. And number 4, ethambutol. Number 5, streptomycin. Ethambutol represented as capital E and streptomycin capital S. These are the examples of first line anti-tubercular drugs. Okay? Isoniazid, rifampin, pyrazinamide, ethambutol, streptomycin. These are the 5 examples of drugs which are used as first line anti-tubercular drugs. First line drugs, you have to remember all these first line drugs, examples, anti-tubercular drugs. Isoniazid, rifampin, pyrazinamide, ethambutol and streptomycin. Capital is capital R, capital Z, capital E and capital S. Okay, then second line drugs. The second line drugs is ethionamide, tapre prothionamide, cycloserine, CS. Okay. Para-aminosalicylic acid, rifabutin. Only you have to remember first 3 and 4 examples of second line drugs. Then fluoroquinolones, among the fluoroquinolones, ofloxacin, levofloxacin, moxifloxacin, ciprofloxacin, all these are fluoroquinolones. They are also included in second line anti-tubercular drugs. And injectable drugs are kanamycin, amikacin, capreomycin. All these are included in second line anti-tubercular drugs. Okay. The first line drugs are more beneficial than second line. If any difficulties or problems are faced along with first line drug, then we select the second line drugs. Okay. We have to discuss the first drug, first line anti-tubercular drug, that is isoniazid. Okay. It is also known as isonicotinic acid hydrazide, and it is represented as capital H. This is the structure of isoniazid. Okay, this is the CONH-NH2. This is the structure of isoniazid. Isoniazid extend anti-tubercular drug, essential component of all anti-tubercular regimens, unless the patient is not able to tolerate it or bacilli are resistant. It is primarily tubercidal. Okay. It is primarily tuberculocidal. Cidal means it will kill the bacteria. It will kill the bacteria. Okay. Isoniazid. Rifampin is also known as rifampicin. Rifampicin and rifampin are same thing. You do not make confusion with rifampin and rifampicin. These are same drug, first line antitubercular drug. It is a semi-synthetic derivative of rifampicin and obtained from Streptomyces mediterrani. Rifampin is bactericidal. Rifampin is, which drug is bacteristatic or bactericidal? You have to mention it. Okay, during the time of examination, you have to mention it is either bactericidal or bacteriostatic. Okay, the first line drug, isoniazid, is also bactericidal. Then rifampin or rifampicin, that is capital R, it is also bactericidal. Okay, bactericidal to M, Mycobacterium tuberculosis. What is the causative microorganism for tuberculosis? Mycobacterium tuberculosis. Okay. Along with Mycobacterium tuberculosis, many other gram-positive and gram-negative bacteria like Staphylococcus aureus, N. meningitis, H. influenza, E. coli, Klebsiella, Pseudomonas, Proteus. Okay, all these are killed by rifampin or rifampicin. Then what is the mechanism of action of rifampicin? It has been mentioned. Rifampin interrupts the RNA synthesis by binding with beta subunit of mycobacterial DNA dependent RNA polymerase. It is an enzyme. Okay, it will interrupt RNA synthesis. It will interrupt or it will disturb RNA synthesis by binding to beta subunit of mycobacterial DNA dependent RNA polymerase. Okay, beta subunit is there in the mycobacterial DNA dependent RNA polymerase. It is an enzyme. ASE is there. The word which is terminated with ASE, that is known as enzyme. Okay, this enzyme, DNA dependent RNA polymerase enzyme. And finally, it will interrupt the synthesis of RNA. This is the mechanism of action of what? Rifampicin. Rifampicin. Mycobacterial and other organisms develop resistance to rifampicin. Many microorganisms, they develop resistance. Resistance means they are not killed by. Okay. However, the incidence of resistant bacilli is less than 10 to the power minus 7. Okay. Then, what are the other uses of rifampicin? Other uses means, the first use is, it is used as first line drug for first line antitubercular drugs. Along with first line antitubercular drug, it has other uses like it is used for the treatment of leprosy, prophylaxis of meningococcal and H. influenza, meningitis. Okay, and second or third line drug, second or third choice means second or third line drug for MRSA, Legionella infections. Combination of doxycycline and rifampin is also first line therapy for brucellosis. Okay, and these are the other uses of rifampicin. Then the third one is pyrazinamide, that is known as Z. It is represented as Z. Okay, you have to remember which is known as Z. I will ask in the next class. What is the short form of pyrazinamide? You have to remember that. Is pyrazinamide is represented as Z. Chemically similar to, it is chemically similar to isoniazide. Okay, pyrazinamide was developed in the year 1952. It is weakly tuberculocidal. It is a weakly tuberculocidal. It is also tuberculocidal. Okay, all these are cidal drugs. They will kill. Tomorrow isoniazide, rifampicin, pyrazinamide, all these are bactericidal. It has been mentioned. Weakly tuberculocidal means bactericidal. More active in acidic medium. It is more active in acidic medium. It is more lethal to intracellular located bacilli. Okay, lethal means it is more effective. Okay. Distributed, has good penetration in CSF, craniosacral fluid. Then because of which it is highly useful in meningeal tuberculosis. Hepatotoxicity is most important dose-related adverse effect. Dose-related adverse effect, that is hepatotoxicity. It will be toxic to liver. Okay. Then the fourth one is ethambutol. Ethambutol is selectively tuberculostatic. Here the static is there. Okay. All the three, isoniazide, rifampicin, and pyrazinamide, all these are bactericidal. But here ethambutol, number 4. Ethambutol, which is represented as capital E, it is tuberculostatic, not cidal. Okay, you have to remember this. Ethambutol is selectively tuberculostatic and is active against MAC as well as as well as some other mycobacteria. This is known as mycobacteria, but not other types of bacteria. It is the number 4 drugs for first line drug for as anti-tubercular drugs. Okay. The mechanism of action of ethambutol is not fully understood, but it has been found to inhibit the transferases, arabinosyl transferases encoded by these genes, EMB, AB genes involved in arabinogalactan synthesis. Okay, you do not have to mention the mechanism of action. Only you have to write something about the drugs. Okay, it is bacteriostatic or bactericidal, and against it is a first line drug or second line drug. These things have to be mentioned. Okay, if you mention the mechanism in very short form also. Okay, mechanism is not required in this case. Then streptomycin. This is the number 5th drug. Okay. Useful anti-tubercular drug, it is tuberculocidal. All among the 5 number of drugs, all are bactericidal or tuberculocidal. Only the ethambutol is bacteriostatic. Okay, only the number 4, that is ethambutol, it is bacteriostatic, and all first line drugs, anti-tubercular first line drugs are bactericidal. It is tuberculocidal. Okay, but less effective than isoniazide or rifampicin. It is bactericidal, but if we compare with the isoniazide and tuberculosis, because what is the reason? Because of poor penetration into the cell. Okay, because of poor penetration into the cell. Thus, other drugs, host defense mechanism are needed to eradicate the disease. Okay, this is all about your first line anti-tubercular drugs. Then we discuss about the second line anti tubercular drugs. Second line antitubercular drugs. These are less effective or less well tolerated antitubercular drugs. They are used only in case of bacillar resistant to one or more first line drugs. Okay, if the first line drugs becomes more resistant, means if there is recurrence, if there is any type of recurrence, means what do you mean by recurrence? जदि हमरो disease थरे भलो disease कौन होइछि माने 100% क्योर हेइनी पुणी सेटा आउथरे आसीबो देखिबो ज्वर छाडी गला परे पुणी आउथरे आसे माने कंप्लीटली भलो हेइ नथिबो तमे मेडिसिन को बंद कर दबो से कोन हो आउथरे सेकंड टाइम जदि आसिला that is more powerful, that is known as recurrence, in the recurrence माने आउथरे नोटिक आसीबो आउथरे कि दिन परे आउथरे सेटा पुणी हबो ओके सेकंड टाइम जदि ट्यूबरकुलोसिस होउची if a patient or if a person is suffering second time tuberculosis, it is the first line drugs are becoming resistant. The first line drugs are becoming resistant. Okay, these are less effective or less well tolerated anti-tubercular drugs that are used only in case of bacilli are resistant to one or more first line drugs, or when these are not tolerated or contraindicated. If the first line drugs are not tolerated by individuals, by any individual or patient, then also the second line drugs are selected. Okay. First one is kanamycin. These are tuberculocidal. Kanamycin is a aminoglycoside antibiotic. You know, aminoglycoside antibiotic, kanamycin. Tuberculocidal, which is cidal and which is static, you have to emphasize on these words. Very similar to antitubercular activity, pharmacokinetic properties and types of adverse effects. So many S-resistant strains, M tuberculosis, remain sensitive to them. Then number 2 is capreomycin, CM. The capreomycin is represented as capital C, small m. Okay, CM. You have to note it. It is a cyclic peptide antibiotic. It is a cyclic peptide antibiotic, capreomycin. Chemically very different from aminoglycoside, but with similar mycobacterial activity or ototoxicity. It has ototoxicity or nephrotoxicity. Ototoxicity means the toxicity to your eye. The toxicity to the ear. Toxicity to the ear is known as ototoxicity. Okay. Then number 3, that is known as fluoroquinolones, FQS. The fluoroquinolones are represented as capital F, capital Q and small s. Fluoroquinolones like ofloxacin, levofloxacin, ciprofloxacin and moxifloxacin are relatively new, potent oral bactericidal drugs. All these are bactericidal, not static, for tuberculosis, for the treatment of tuberculosis. Okay. And these are other ethionamide, ETH, ethionamide. This is also a second line antitubercular drug. It is antitubercular drug of moderate efficacy introduced in 1956. Okay, ethionamide, ETO, capital E, small t and small o. Okay, chemically it resembles with isoniazide, INH, but contains sulfur. The mechanism of action is also similar to isoniazide. It is converted by mycobacterial into the active intermediate which interferes with the mycolic acid synthesis. Mycolic acid is a constituent of cell wall. Okay. Tuberculosity of ethionamide is very poor. Frequent adverse effects are there. Okay, and the adverse effect like nausea, vomiting, salivation, metallic taste, epigastric discomfort. The upper part of the GIT discomfort, that is known as epigastric discomfort. Okay, then prothionamide, PTO, prothionamide, it is the number 5, second line antitubercular drugs. Okay. Then cycloserine, CS, capital C, small s. This antibiotic obtained from S. orchidaceus is an analog of D-alanine. It is an amino acid. Accordingly, it inhibits the bacterial cell wall synthesis. Okay. If the bacterial cell wall synthesis will be inhibited, then what happens? It is bactericidal or bacteriostatic? It is bactericidal. Okay. CS, this CS is bacteriostatic. It will inhibit, not stop. That's why it will be bacteriostatic. In addition, it inhibits then we discuss the drug regimen, regimen or biology of tubercular infection. Then what are the goals of anti-tubercular chemotherapy? How we are able to treat the tuberculosis? How we are able to, what are the aim for the treatment of tuberculosis? Okay. The first one is kill the dividing cells. We have to, the goals of anti-tubercular chemotherapy are, what are the goals? What are the aims of anti-tubercular chemotherapy? We are providing different combined anti-tubercular drugs have to be given. Okay. And what is the aim? What is our goal? Number 1 is kill the dividing bacilli. Number B is kill the persisting bacilli. And number C is prevent emergence of resistance. Okay. How we have to make sure that there will be no resistance. There will be no resistance of the drugs. Okay. Prevent emergence of resistance. We have to prevent the resistance formed by the bacteria. We have to prevent this. Okay. How the bacteria cannot make resistant to a certain type of drugs. How they are becoming resistant? An antibiotic, any type of antibiotic, it will become resistant. How? If we use it for multiple times. Okay. Frequently, yes. Nowadays आम कौन से चिकेन सब खाऊे ना, चिकेन मान को एंटीबायोटिक दिया होची, थ्रो दी चिकेन आमर एंटीबायोटिक आम बॉडी को आसुची, एंटीबायोटिक आसुची ना हमको किसी डिजीज हेनी ता परे मध्ये हम एंटीबायोटिक जदि नउचे हमको जेतेबेला डिजीज हबो सेतेबेला से एंटीबायोटिक काम करिवो नाही, दैट इज नोन एज रेजिस्टेंस. ओके. तेणु आमे रेजिस्टेंस को प्रिवेंट करिवा. हाउ the anti-tubercular drugs not becoming the resistant one. Okay. The number 1 is we have to kill the dividing bacilli. The bacilli, Mycobacterium tuberculosis. Okay. It is a type of bacilli. Bacilli means it is a rod-shaped bacteria. All the rod-shaped bacteria are classified as bacilli. Okay. The bacilli we have to kill the dividing bacilli. They are dividing, they are multiplying their numbers. How we are suffering from a disease? If coronavirus enter into our body, then it will create disease? No, it will multiply. First it will multiply inside our body. Then if their numbers are too much or larger, then we will suffer from coronavirus. Likewise tuberculosis, the bacteria will these are communicable diseases. The bacteria will enter into our body. First they divide type of disease. What is the goal? What is the aim? We have to kill the dividing bacilli. The bacilli which are more actively dividing, we have to kill them first. We have to kill them. Then number two, kill the persisting bacilli. They are not dividing, but they are remain present in our body. Then we have to kill the persisting bacilli. The third one is prevent emergence of resistance. The bacteria who are creating the resistance, we have to prevent them. How they will not create the resistance in our body. This is the three aims or three goals for the treatment of tuberculosis. Okay, you have to write it. You have to write in your answer people likewise. Okay, kill the dividing bacilli. Drugs with early bactericidal action rapidly reduce bacillary load in the patient and achieve the quick spectrum negativity so that the patient is not non-contagious to the community. Transmission of TB is interrupted. Okay, transmission, it is a communicable disease. It will communicate among the peoples. It will communicate very easily. It will spread and become pandemic, Mahamari. Okay. That's why not to communicate, we have to prevent this by killing the dividing bacilli. The bacilli which are actively dividing, they will spread the disease from one person to another. Now first we have to stop the spreading of disease from our society. Okay. Then number B is kill persisting bacilli to affect, cure and prevent relapse. Relapse means, what is relapse? Again the disease will appear in our body. That is known as relapse. Okay, prevent emergence of resistance so that the bacilli remain susceptible to the drugs. Okay, যদি আমি resistant को prevent कर दबा, ताहले that type of antibiotic remain susceptible. Susceptible and resistance are two opposite words. Resistant means the bacteria is not killed by a specific type of anti-tubercular drugs or antibiotic. Okay, if it will be killed, then that drug is susceptible. These are two opposite words, resistance and susceptible. Okay, susceptible means it will be killed, and resistant it will create resistance. It will not be killed. Okay. Then conventional regimens are there. Drug regimens. What do you mean by drug regimen? Definition will also come. Definition will also come in your examination. Drug regimen means the combinations are selected to maximize the above actions together with considerations. Okay. Conventional, this is the conventional regimens, means drug formula. Here the multiple drug therapy is there. Okay, at once we have to administer a multiple number of antibiotics. By only one antibiotic, by the help of only one antibiotic, we are not able to treat the tuberculosis. We have to give multiple drugs, multiple antibiotics at once. That's why the drug regimen is there. The drug formula is there. There is a drug formula. Okay. Conventional regimen, it consists of, it is a conventional, it is a common type, very common type. Okay. The drug regimens are also different. Okay. The duration of treatment. If we provide 3 months treatment, if we provide 6 months treatment, if we provide 1 year treatment, there are duration of treatments are there. Variation of duration of treatment are there. Okay. The conventional regimen are, these consist of age. What do you mean by age? I have told before. Age means, what is age? I should know it. I have told, na? That's why I have told what it has been mentioned. What it has been mentioned. You have to remember all this time. Rifampin R or rifampicin R. Rifampin, that is R. Then pyrazinamide, that is Z. In the drug regimen, streptomycin, that is S. Ethambutol is E. Okay, FQ, fluoroquinolones, kanamycin, Chem. You all have to remember, because in the drug regimen study there is only here H plus E, ethambutol, or without S. Here without S means without streptomycin. Okay, for initial 2 months. For the initial 2 months, you have to give H. H means, right? What is H? Kotha, sit down. Isoniazide or plus TZN or E, ethambutol, with or without S. With or without S. S means streptomycin for initial 2 months. First 2 months you have to give. It is a conventional. It is a very common type of tuberculosis treatment. You have to give isoniazide, ethambutol with or without streptomycin for initial 2 months and require 12 to 18 months therapy. For the treatment of tuberculosis, here we require 12 to 18 months. 12 to 18 months therapy, and the first 2 months require H, isoniazide or ethambutol with or without streptomycin. This is a very conventional type of regimen for the treatment of tuberculosis. Okay, then blood pressure is 13. Okay. Then short course chemotherapy. Short course. The 12 to 18 months is very large time. No one have such type of patients. This is a long-term therapy. Okay, that's why we have to reduce the time. We have to reduce the time. That means we have to give more drugs. Okay. Short course chemotherapy after several years of initial or WHO introduced 6 to 8 month multi-drug or short course regimen in 1995. It has been discovered. That is known as DOTS. DOTS. What is the full form of DOTS? Directly observed therapy. Directly observed therapy. Okay. An expert group framed clear-cut treatment guidelines in 1997. Okay, clear-cut. Previous treated case into 4 categories. No, 6 month regimen are there. These are this 6 month regimen. 6 month regimen. Recommended doses of antitubercular drugs. Patients over 60 years age, 10 milligram per kg. These are the treatment of tuberculosis guidelines, 4th edition. And drugs are isoniazide, rifampin or rifampicin, pyrazinamide, ethambutol, streptomycin. And this is the doses. Mg per kg, milligram per kg. Okay. And this is the 3 times per week dose. The drug regimen. Okay. Then tuberculosis in pregnant women, the WHO and thoracic society consider HREZ. Isoniazide, rifampicin, ethambutol, and pyrazinamide. You have to remember. What is Z? What is Z? Kichhi suno no. And not listening. If you properly listening, 50% memorize. HREZ. H means isoniazide, R rifampin or rifampicin, E ethambutol, and Z is pyrazinamide. Okay, you have to remember this. The WHO British, this is safe. Safe for the treatment of tuberculosis in pregnant women. In pregnant women, you have to remember all this. In case of pregnant women, HREZ to be safe to the fetus and recommended the standard 6 month. This is a standard 6 month therapy. Standard 6 month therapy. I have shown the table. I have shown the table. This is the standard 6 month therapy for HREZ. HREZ. Okay. This is HREZ and S. HREZ. Primarily this is, and you have to add or do not have to add this streptomycin. This is the standard 6 month therapy for the tuberculosis. Okay, and this type of therapy can be recommended to the pregnant women, because these have no side effect to the fetus. Okay, tuberculosis in pregnant women. The HREZ to be safe to the fetus and recommended to the standard 6 month. Okay, regimen for pregnant with TB. S is contraindicated because it is ototoxicity to the fetus. In case of pregnant ladies or women, S will have to be discontinued because S has ototoxic effect. Auto means toxicity to the ear of the fetus. Okay. Why? MSc, the full form is the कौन पाठ हो सी लोग दिखा बंद कर दो